So I'm Laura. I'm a registered chiropodist practicing in downtown Toronto alongside a rehabilitation team. I'm an elite runner and I fully believe in the science of rehabilitation to help those dealing with this injury. To start with, plantar fascia is a tissue that originates on the calcaneal tubercle, medial and lateral bands, and inserts here. You can have pain anywhere along that band. And yes, you can even have pain up here. Why does it happen? Typically, overuse injuries, too much too soon, lack of support, lack of strength, and lack of flexibility. So sometimes we have a tight calf, gastrocsoleus complex that has a knock-on effect to ankle range of motion. And when that is tight, it can lead to pulling and stress here. Not only that, it can affect our mechanics when we're running and walking. We try to get around that range of motion. The other reason can be lack of strength in the tib post, lower calf compartments. So the soleus muscle is very important with running, and it can sometimes be forgotten because the gastroc gets a lot of work when we're walking, but the soleus sometimes gets neglected. And having that being able to fire as a rigid lever and keeping our intrinsics in check, because when we walk, for the plantar fascia to work properly, the first has to ground, and then when you toe off, it should plantar flex so that you can have the toe dorsiflex so that the plantar fascia mechanism works properly. And if that's an error, then we can get stretching and injury to that area. So working on foot intrinsics is really important. So that's toe flexion, doming exercises, calf work, tib post work, and lots of stretches. But it has to be done in a progressive manner where you are in your rehab. And then for runners, I definitely like to load that with weight. Signs and symptoms typically include that first warning step pain, sharp pain, pain that starts to warm up. Sometimes you can even feel pins and needles, like tingling sensations, throbbing sensation, a heartbeat sensation. Those are all things that can, and even a bruise-like sensation can happen. In more severe cases, it can look a little bit puffy. Sometimes the other intrinsic muscles, our abductor muscles, can start to take over to stabilize the foot. And then you can even end up with a secondary Baxter's nerve entrapment because of the hypertrophy of the abductor muscle. So when we're dealing with this, it's all about load management. So looking at your overall steps, looking at overall volume, trying to reduce that. Try to always walk around with support. There's a lot of academic literature that indicates support early on in the stages of the injury can help with pain reduction and help speed up the progress of the recovery. So you want to protect that tissue. It's injured, it's beat up, it's hurt. It needs a little bit of help. You can't just think that walking around barefooted on it is going to somehow strengthen the foot. We want to strengthen our foot, yes, when we're in a controlled environment, but excessive load on it just can't handle at that time. So in the house, you want to wear something supportive. Taping helps, orthotics help. And then when if you're chopping, you're prepping your food, you kind of want to sit so that you're able to take some stress. Those little things do go a long way. In the beginning, anti-inflammatories can help. The frozen water bottle rolling, stretching, and really trying to take it easy so we get that pain scale down. And then in that phase, we can also work on your foot intrinsic exercises, some maybe seated calf work, banded work, and then we progress from there. So then as we get into the later stages, I really like the towel rolled up dorsiflex toes calf exercise. I'm a really big fan of toe flexion. And then moving into adding in weight specifically for a runner. Maybe we start on 2 feet, then we progress to 1 foot. We can start with isometrics. So a lot of the literature that I follow for plantar fascia is in line with tendon rehab as well. Isometrics are an excellent place to start for people as well. In the chronic stages, that's when it gets a little bit trickier. So in the chronic stages, shockwave is beneficial. And again, just load management. So reducing your overall stress on that tissue while we try to strengthen and rehabilitate. So if you're dealing with this, we'd be happy to help you. I'm very passionate about getting people back to doing what they love to do. I'm a runner myself. I need to run as part of my healthy, active lifestyle. And I really understand the importance of that to other people. So thank you.